Fighting asthma together. Asthma is a medical condition affecting the lungs and airways, developing most likely from childhood. In 2019, over 260 million people were diagnosed with asthma, and 461,000 died due to this long term chronic condition. What happens in the airways? In normal periods, your smooth muscles are relaxed, with a large lumen and a thin mucus layer. If you have asthma and have an asthma attack, the smooth muscles of your airways become tight and constrict, therefore becoming narrow. What are the risk factors? Not all causes of asthma are known, but some factors may predispose you to it. If a family member suffers from asthma or other allergies, you will be more likely to get it. Secondly, exposing yourself to certain particles in your job, such as silica, wood, or chemicals, may also predispose you to asthma. Lastly, environmental asthma can be triggers such as dust, mold, pollen, and pollution that are in your direct environment. The airways in asthmatics has reacted aggressively to the irritants, which triggers the acute symptoms that asthmatics typically have. What are the common symptoms? Chest tightness, shortness of breath, difficulty breathing, coughing, which is usually worse in the morning or night, and wheezing. Wheezing is an audible high pitched note whilst breathing, especially when breathing out. Although these are the symptoms of asthmatics, not every asthmatic will have these symptoms, and not everyone with these symptoms has asthma. So it is important to get any of these symptoms checked out by your GP so they can make a correct diagnosis. What could you expect from your GP visit? Your GP will ask you whether you have a family history of asthma as well as any other relevant history. Your GP will listen to your lungs and will perform a spirometry test, which is a test performed using a spirometer, a small machine connected to a mouthpiece by a cable. A spirometry test measures how much air your lungs can breathe in and out in one forced breath. This determines how difficult it is for you to breathe and determines whether you are getting enough oxygen to your blood. What types of medications or inhalers are there for asthmatics? They are divided into two categories: quick relief and long term control. Quick relief is for rapid, short term relief of symptoms used to prevent or treat an asthma attack. They are defined as short acting beta agonists as they act on the beta receptors. If there is no relief or if you are having more serious attacks, your doctor might prescribe oral or IV corticosteroids. Long term control works to control chronic symptoms and prevent an asthma attack. It is the most important treatment for asthma because it works to treat the condition. Medications under this type include inhaled corticosteroids, leukotriene modifiers, and long acting beta agonists. It is really important that even if you start getting better, to continue to take the long term control inhaler, also known as the preventer, because this is what is treating your condition in the long term. The more adherent you are to your long term control medication, the less dependent you will find yourself on the quick relief, which is predominantly what you should be aiming for. So take your long term control every single day, no matter how you feel, unless your doctor otherwise tells you to stop. Remember to take all required inhalers everywhere, even when travelling. What can HelloDoc provide for you? We at HelloDoc can make it easier for you to access your medication refills. If you are new to the Netherlands and don't have access to a family doctor or GP, then we are also here for you. If you have any questions or would like to book an appointment with us, head to our website at www.hellodoc.nl.